Join me in welcoming Dr. Tejas, and on to you. Thank you very much for accepting our invitation and for being with us today.
So thank you, Revati ma'am, for your kind introduction. It's a great pleasure to be on my school's YouTube channel to be talking about COVID. And rather than COVID, talking about how we can change our mindsets about this new thing which has come into our life. I would just like to show the masks and how you're supposed to wear them. So we have very different kinds of masks available, and I believe people should know what kind of mask they should be using and when they need to use a mask. So whenever you are alone, you don't need to wear a mask, okay? Especially like if you're driving a car, if you're walking on an empty street, there's no need to wear a mask. But when you are in a crowded area where you see people are going to be, that there are a lot of people around you, it's always better that you have a mask on. And there are different kinds of masks available. So you have this kind of a cloth mask, which is multi-layered cloth mask, and which is the most commonly used. You can see that it's got an elastic band which you can hook it behind your ear, and this becomes easy to put and easy to remove also. The important thing is, once you've been using the mask, it's advisable not to touch the outer side of the mask. So you should be touching only these elastic bands to just remove it, and don't touch it and put it to washing. And you need to wash it with warm water and soap. Then you have a surgical mask which looks like this, and you can see it has got a white line here, and that white line should be on the top and this side should be on the lower side. It is a metal strip which will contour around your nose, and that will help it to sit firmly on your nose. And those who wear glasses usually have a problem with a mask because it causes fogging of your glasses. So this is a surgical mask which is usually used by doctors in the hospitals. You can use these also, but these cannot be reused. So you need to throw them after one use. And then we come to the N95 mask, which has become very popular, and it is the N95 stands because it filters around 95% of the virus if you are in an area where the viral load is high. Again, it has got two elastic bands, and when you're wearing this, again you put it like this on your nose and mouth, and then put these elastic bands on the top of your head. As I said, the outer part of the mask is mostly contaminated, so you're not supposed to touch the outer side whenever you're removing it. This mask can be reused if you're keeping it in a clean place, but again, it is not very recommended for general people. It is mainly for doctors, and it is especially for doctors working in ICUs, because it's not a very comfortable mask. You can't really breathe so easily with this kind of a mask. So these are the general masks which are in use. So I think there's one question about health infrastructure in our city. I believe we all are aware that the health infrastructure is quite lacking in our city, and this is not just happening today, but it's been a long time since. The problem with our country as well as our city is that the number of people which we need to handle is very high. So even if I showed you some percentages over there, now if you calculate, India is a country of 130 crore people. Now if you calculate if 2% of that or 5% of that, it becomes a huge number. And I'm sure we do not have that much, but I still feel, as we said, 80% are going to be good, not going to have much of a problem, have mild symptoms. What happens is the fear sometimes takes over you too much, and that can cause more problems than the actual disease. So the health infrastructure, I believe the government is trying to increase, but it is not a very easy job to be done, because the health infrastructure just doesn't mean putting on more beds. You need trained people to take care of these ill patients and critically ill patients. So they're trying to get doctors from outside the state also, and I think they're trying their best. Actually, it is not a virus, it is an antibody. I think that's a wrong statement by somebody. It is a virus, and that virus causes an immune response in our body, which makes the body form antibodies to the virus, and that's the right answer. Okay, so there is a question about surface transmission. So the main transmission of this virus is via aerosol generation, and that happens when we talk, when we cough, when we sneeze. So, or when we laugh out also loudly. So that is the aerosol which is coming out from our mouth. And if you are close by, the aerosol may go to you directly on your mouth or to your nose and then go into your lungs. That's the commonest way of transmission. The second way of transmission, that is the surface transmission, is not a direct method of transmission. And the CDC believes that's not a very important method of transmission of the virus. It is a possibility theoretically that if a person coughs or sneezes, the virus may land on the surface. And if incidentally you happen to touch the surface and then touch your nose or your mouth or your eyes, then you might get the disease. So I don't think that is a big problem of surface, but wherever there is too much movement of people, those surfaces need to be sanitized on a regular basis. Like if it's a hospital, if it's an office, or maybe if it's a school later on, if people are moving in and out, touching the handles, it's always better to get them sanitized. Also, it is better to keep your surroundings clean, use a good sanitizing solution to clean your floor. A good question about posture, because most of the people are going to have virtual classes now, and I believe our children are also going to have virtual classes. It's very important that you assign a desk and a good chair for them to sit properly, have a good posture. And what do we mean by a good posture is see to it that your screen is at your eye level so that they don't have to strain their neck while looking at the screen either up or down. Secondly, the chair needs to have a proper armrest so that the arms can be rested well while writing or typing anything. The back also needs to have a proper back support. Secondly, everybody should take a break after 40 to 45 minutes of continuous sitting. See to it that they also have a foot rest so that the feet can be on a level higher, so that keeps the legs also supported. Doing all these things will give a good posture and will not cause neck or back issues. And also, as I said, it's important that they do some kind of a physical activity at home. I think the best would be to do yoga or to do Surya Namaskar if you know how to do it well, because it gives you a very balanced stretching of your spine, both bending forwards as well as bending backwards. What's the real picture that's unfolding around us and how distant are we from normal world? I think we need to redefine our normal world. So even I can't answer that question to be perfect about how or when we will be back to a normal world. But I think looking at it, if we have started to develop herd immunity, that is that if many people are asymptomatic who have already got infected and developed immunity, but there is no way we can know that unless we have the antibody testing, and maybe that may come in another 2-3 months. But I think we need to change the definition of our normal world. We'll have to maintain social distance. We'll have to wear masks, especially when we are moving out of the house. And that is going to be our new normal. Can Corona recur? I doubt it can recur. Not a very scientific answer, but usually the immunity that the body develops to these viruses should last quite a long time, until and unless the virus mutates. Now, if the virus mutates, one, it can lose its virulence, that is its infectivity and its ability to cause disease. It may reduce, so then it is good, and maybe we'll be better off faster. But Corona cannot recur. So there were some studies which showed that the RT-PCR test was coming positive even for a long time, and then they thought maybe it is the dead virus's RNA which is left which was causing it to come positive. Please suggest authentic ways to improve immunity of our children and elders. I think improving immunity includes doing some kind of a physical exercise, and right now, as I said, we will have to do it at home, and yoga is really good to do that. Second, in your diet, include vitamin C. I'm sure you know which foods contain vitamin C. All the citrus fruits are rich in vitamin C. Amla is a very good source of vitamin C. increase the intake of zinc in your diet, and you get zinc mainly from meat, fish, and also from seeds such as pumpkin seeds, sesame seeds, and also from legumes. So include all these in your diet. Also take good amount of proteins. Also get good sun exposure, because sun exposure is going to give you good amount of vitamin D, and all this is going to help you build good immunity. I would like to end this session with 2-3 very important things. We need to be careful, and that is going to be our new normal: wearing a mask, maintaining social distance, and washing our hands, keeping our hands clean, and avoiding touching our face. So these are the main important things. If you take care of this, I think we will be much better off from this COVID thing. And stop stigmatizing COVID. I'm sure we will be okay, and we will overcome this fear and this COVID also. Thank you very much.